Welcome to The Explainer. Today, we're jumping right into the 2018 periodontitis classification system. And let me tell you, this is way more than just some academic update. It's a total game changer for how you assess risk and, maybe more importantly, how you talk to your patients every single day. So for years, for our entire careers pretty much, we've all lived with these two terms, right? Chronic and aggressive periodontitis. They were the foundation of how we talked about the disease. But as you probably know by now, the ground has completely shifted.
Yep, you heard that right. It's obsolete. The 2017 World Workshop basically threw out that old chronic versus aggressive model. It's been totally replaced by a new framework that's way more dynamic and honestly a lot more useful in the clinic.
Okay, so here's our roadmap for today. We're going to start with why the old system just wasn't cutting it anymore. Then we'll dive deep into the new staging and grading system, and I'll walk you through step by step how to actually use it. And then we'll see how it all comes together to paint a really clear picture of your patient. So first things first, why fix what wasn't totally broken? Well, let's take a look at the problems with that old 1999 classification that really pushed the need for this big change. At the end of the day, the old system was just, well, it was fuzzy. There was this huge gray area between chronic and aggressive. You'd see a younger patient with severe bone loss and wonder, is this aggressive or just really advanced chronic? That diagnostic imprecision made it tough to be consistent, which was a real problem for both patient care and for research. And that's where the new framework comes in. To fix those problems, it gives us this awesome, multidimensional approach that paints a much richer and more descriptive picture of what's going on with each patient. Okay, so this is the first huge takeaway. We don't have those separate buckets anymore. Now everything starts under one big umbrella diagnosis: periodontitis. It's a simple starting point, I know, but all the juicy details come right after. And those details are staging and grading. Just think of it like this. Staging tells you what's happening right now. How severe is the disease and how complicated is it going to be to treat? Grading, on the other hand, is like our crystal ball. It tells you about the biology of the disease, how fast it's moving, and what the patient's future risk looks like. All right, time to get practical. Let's walk through how you actually use this stuff with a patient in the chair. The very first thing you've got to do is figure out their stage. Now, I know this table looks like a lot to take in at first, but trust me, it's your new best friend for staging. It's really built on three main ideas: severity, which is your starting point; complexity, which are the things that make treatment trickier; and extent, which is just about the pattern of the disease. Let's break it down. So the whole process is a pretty straightforward three-step dance. First, you look at severity to get your initial stage. Then, you scan for any of those complexity factors that might bump the patient up a stage. And finally, you just describe how the disease is spread out in the mouth. Now, this is absolutely critical. So if you remember one thing about staging, let it be this. Your primary measurement, your go-to for determining severity, is clinical attachment loss, CAL. It's not about picking whichever number is worse, CAL or radiographic bone loss. You start with CAL. Only if you absolutely can't get a reliable CAL should you default to using RBL. And here's where it gets really smart. Let's say a patient's CAL puts them squarely in stage 2, but they also have a class 2 furcation, or maybe some secondary occlusal trauma with mobility. Or, and this is a big one, they have fewer than 10 opposing pairs of teeth left. Any one of those things automatically kicks them up to a higher stage, like stage 3 or stage 4, because the case just got a whole lot more complex to manage. So the last little piece of the staging puzzle is adding this descriptor. Is the disease localized to just a few teeth, or is it generalized, affecting more than 30%? Or does it have that classic molar incisor pattern that we used to link with what we called localized aggressive perio? It's just one more layer of useful info. Okay, you've got the stage figured out. Nailed it. Now you're ready to assign the grade. And remember, the grade is all about the biology of the disease. How fast is it moving and what's the risk? This framework right here is what helps us predict what this disease is going to do next. We use this evidence to classify the rate of progression as either slow, which is grade A, moderate, grade B, or rapid, which is grade C. Now, to make this easy to use in a busy practice, the system gives us a fantastic starting point. For every single patient, you just assume they are grade B, moderate progression, to begin with. From there, you look for evidence to either shift them down to A or, more importantly, up to C.
And that evidence comes in a couple of forms. First, you've got the actual rate of progression. If you have old x-rays, you can measure it directly. If not, you can estimate it with that clever bone loss to age ratio. But second, and just as powerful, are the grade modifiers. We're talking about major risk factors, like smoking 10-plus cigarettes a day, or a diabetic patient with an HbA1c of 7% or higher. The presence of factors like these can automatically bump a patient into grade C, flagging them as high risk.
Okay, so we've covered staging, we've covered grading, so what does this actually look like when you put it all together to create a really complete and insightful diagnosis for your patient? Let's just walk through this example. We've got a 45-year-old heavy smoker with poorly controlled diabetes. Right off the bat, their attachment loss and bite collapse put them into stage 4. It's affecting most of their teeth, so we add the generalized descriptor, and because they're a heavy smoker with a high HbA1c, they are without a doubt a grade C. So their full diagnosis is generalized periodontitis, stage 4, grade C. See how much more that tells you than just calling it severe chronic periodontitis? It tells a whole story. And that's really the heart of why this new system is so powerful. It pushes us beyond just looking at severity. It makes us think about how complex the treatment will be. And most importantly, it forces us to look forward and assess a patient's future risk. This is a huge leap toward truly personalized medicine in our field. So the last thing I want you to think about is this. This new system doesn't just change how we write things down in our charts. It completely changes the conversation we can have with our patients. It gives us a clearer, more precise language to explain exactly where they stand, how complex their treatment will be, and what their personal risk looks like for the future. And that is incredibly powerful.